Hi there, everyone. Welcome, welcome, welcome to I Talk with Pastor, conversation about life and faith. Now, it may be your first time, or like Sister Gracelyn, who's here already online. Good evening to you. You are committed to tuning in, and so we thank you for being here. Now, our discussion tonight centers on diabetes. Last week we spoke about cancer, and if you missed that episode, I want you to go on to the YouTube site so that just go to Nicola English and remember, friends, to like the videos and subscribe so that you can share and so you can know what is happening. Please subscribe to Nicola English. Moving on from that, so we will put that, of course, in the link so you can see last week when we spoke about cancer. Now, for those of you who are aware, November is Diabetes Awareness Month. And you may be wondering, so wait, so I Talk with Pastor has now become what? A health program? No, I talk with pastors for every aspect of your life. It's life and faith. And because diabetes is so important, we wanted to say, hey, guess what? Let's deal with this issue also right off the bat, as we would have dealt with cancer. Now, the 14th of November is recognized as Diabetes Day, and the whole month is Diabetes Awareness Month. All right. Now, overall, diabetes is crucial to reduce the burden. To It's crucial. It is crucial knowledge for us. Why is that so? Because it is affecting so many individuals in our society, and so diabetes awareness is important so that we can reduce the burden of diabetes on individuals and society by educating people about the condition and its risk factors. So, if you know somebody who really needs to have this information, what do you think you need to do right now? Share, 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 share. So I'm giving you a moment right now. Take the opportunity. You have it right now. Just share it on your Facebook page. You can share in your WhatsApp. Share the link and you can save a life. I always like to say that. Share the link, save a life. Now, the slogan for this year for diabetes awareness is know your risk, know your response. And because I am no health professional, I am a pastor that is just concerned about your health. I've invited one of the top notch young doctors in the Caribbean, Dr. Curly and Tobias Joseph. Now, if you do not know her, you have to know her. I mean, she's so energetic and lovely to be around. Now, Dr. Tobias achieved her dream of becoming a medical doctor in 2008 when she graduated from the St. George's University. She began her career in medicine at the Eric Williams Medical Sciences Complex in Trinidad and the Scarborough Health Center, well, not Scarborough Health, Scarborough General Hospital, before becoming an entrepreneur. Yes, she is an entrepreneur because she now runs the Emerald Health and Wellness Clinic. Dr. Tobias Joseph enjoys singing, laughter, and she's just dedicated to health ministry and the gospel. So, Dr. T, welcome, Dr. Tobias Joseph. Welcome to I Talk with Pastor. It is so great to have you. You can just unmute so we can hear your wonderful voice. Welcome, welcome. How are you?
Thank you so much. I'm doing fine, thanks.
Excellent. Excellent. Now, you have joined us this evening, and I want to give you your time to talk to the people because this is not my area of expertise, so I'm giving away. And you hear and you want to talk to the folks about diabetes. You remember, friends, you can also tag a friend, tag a family member, tag somebody. You're like, I don't want to miss this information, so I don't want to share and come off. That's okay. You can tag someone right now that you know needs to hear this info. So, Dr. Tobias, talk to us. Tell us about this whole diabetes situation Um, Here, go right
Sure.
ahead.
So, good evening, everyone. It's really a pleasure to be on I Talk with Pastor this evening. And Pastor English, as you rightly said, yes, actually, next week, Tuesday, right, the 14th of November, every single year is World Diabetes Day. World Diabetes Day. And this year, their focus is empowering global health. That's the theme, empowering global health. Now, what is diabetes anyway? When we hear the words diabetes mellitus, what is it? It's really lots of sweet urine. Why would you know that the urine is sweet? That's an interesting question. I guess you can ask the ants that follow your urine when it happens to spill out of the toilet bowl for anyone who happens to be diabetic, right? But that is literally what it means. Now, what is the burden of diabetes? The thing is that diabetes affects over 500 million persons worldwide.
Wow.
Over 500 million persons. Now, only 9 million of those persons have type 1 diabetes, and type 1 typically would occur in children. Um, you hear about children, they're going to their, Christmas parties coming up, but they can't have any lollipops, right? And this is not preventable at all. It just happens by a sudden mutation, and they
Wow.
can no longer process sugar, and they need to be on insulin. But
Wow.
the other diabetics, no, they are type 2, which is absolutely preventable. So they make up the gross majority of the burden of diabetes. Now, the interesting thing is that 1 in 10 adults suffer from diabetes type 2. 1 in 10 adults. So if we have 10 persons on the chat right now, whoever is looking on, you just for every 10 person, there may be one person. So make sure that it's not you. And the trouble is that 3/4 of the world's diabetic population actually reside in middle to low income countries. And we would be considered a third world country. And definitely we have a lot of diabetics here. And the discomforting fact is that 1 in 2 diabetics, so every time you see two diabetics, one of them does actually not know that they are diabetic at all. So still there is the trouble in statistics for some years now that 50% of persons with diabetes do not know that they have it.
Okay,
So the,
pause for that. Pause for that, Doug. I don't
right?
want us to miss that information. You're saying
Mm-hmm,
that there are 50% of the people that have diabetes do
mm-hmm,
not know. So even the statistics that we have out there, which is over 500 million people, that's a lot of individuals.
mm-hmm,
Those are the ones who would have checked and know.
mm-hmm.
So we can possibly have another 500 million who do not know.
Well, and the thing is, I think persons just don't pay attention to the symptoms, and not everyone would have glaring symptoms.
All
So
right.
let's get into what those symptoms would be,
I
right?
would like to know that. What are those symptoms? What are those symptoms?
Well, remember we said that diabetes mellitus means lots of sweet urine. So definitely one of the symptoms is frequent urination.
Okay. Okay.
Waking up at night to pass urine, needing to urinate every minute, every time you drink water, you need to urinate. But some persons would say, well, I urinate a lot because I drink a lot of water. You say, well, why do you drink so much water? Well, guess what? One of the other symptoms is excessive thirst. So you find that persons who are diabetic are going to be really, really thirsty. They're going to be drinking a lot of water. Some persons have excessive hunger. They may feel tired. They may lose weight, have blurred vision, and even a bit of dizziness. All right. And now, when you listen to these symptoms, it can sound like so many other things. A man might think, oh, it's my prostate acting up. Without checking anything, he goes to buy something for prostate. All right. But it could just be diabetes. Or you might be thinking, oh, I was stressed out and I lost some weight. Well, you need to check. All right. So these are just some of the symptoms of diabetes mellitus. But how do you know for sure? You can't say, well, I urinate
Yes,
in plenty.
symptoms. Well, what about the symptoms, doc? Before you go on to now, for sure. Some
Mhm,
folks say like if you scratch a lot, we're gonna get to some of those myths. But if I'm itching a lot, could that mean, is
mhm.
that one of the symptoms that I may have diabetes?
Well, it can be one of those sequelae. One of the things that can happen with diabetes is that it affects your nerves. It can also damage your kidneys, and someone with bad kidneys can have a lot of itching, right? Or when the nerves are going bad, you can have some symptoms there as well. So, how do you know for sure? What do you need to do to know if you have diabetes? Guess what, people? And everyone always asks, is there a way of doing this without sticking your finger? Well, we still kind of need to stick the finger, sorry to say. All right? Sticking the finger is still necessary. So if the first thing when you get up in the morning, you check your sugar and it is more than 126, that is in the diabetic range. So if your sugar is 127, that's in the diabetic range. If your sugar is between 110 and 125, that's borderline. So anytime you check your sugar first thing in the morning and you get anything more than 110, you need to watch it. And don't feel safe it's 109. If you see in 109, it's like, oh, saved by the bell. No, you're a bit too close to the line. What about randomly during the day? Randomly during the day, if your sugar is more than 200, that's in the diabetic range. If it's between 140 and 200, that's borderline. And if it's less than 140, that would be considered normal. Now, the nice thing is that technology is a wonderful thing. And there is this particular blood test called the HbA1c. And what that really means is just glycosylated hemoglobin. So it's like when your red blood cells are going through your bloodstream, they're rolling around in there. And your red blood cells would typically have a lifespan of about 4 months. Whilst they're rolling around, they're going to pick up sugar. All right. And whilst they pick up sugar, um, it's what we will call glycosylation of the hemoglobin, and that number can be tested so that when we check the HbA1c, we're able to tell how much sugar has been attached to your molecule over the course of a 4 month period. So it kind of gives us a good summary. So the normal HbA1c is less than 5.8. All right. So between 4 and let's say 4 and 5.5, which we considered absolutely normal. When you start getting up to 5.7, 5.8, 5.9, that is considered to be borderline. Anything over 6 is definitely borderline. And once you cross 6.5, that is diabetes. So this is one of the ways that you know that you're diabetic. These are the signs of diabetes. And of
Oh,
course, a simple thing would be to test
yeah.
the urine to see if there is sugar in it. Yeah.
But you're saying that to test that if there's sugar, but I have to spill some on the floor and see if I follow it. I want to understand because usually women don't spill. So if one
No.
of the sign is that ants will follow, how do I get to check? I can't taste it. Of course not. So how do we check the sugar? Is it a spill? I want to clear that up.
Well, definitely spills do occur and the ants may give you away. But normally there's a strip that they use to dip into the urine. Once again, thank God for technology because I don't know, I would have made out to be a doctor back in the days when the test was a taste test.
Hmm.
You had to taste the thing. And if it was sweet, you had sugar. I'm
Oh,
good.
okay, but I want to recap, and then let's just pause here for those who are joining. Marva, good night. Everybody, Joy, of course. Shirley, guys, good night. Welcome again to I Talk with Pastor. We are here discussing diabetes with Dr. Tobias Joseph, and this is getting serious because I like things to be clear. Doc, you know me. I want it to be clear. So we're trying to find out if I have diabetes. And of course, we're going to go to those who would have already, who already have diabetes. But if I have diabetes, or if I want to know,
Mhm.
so if there's a blurred vision, if there's ants following the urine, what else? What else could be,
If you're
A little
thirsty all
indication.
the
If I'm
time,
thirsty after time, if I urinate frequently,
yes, you're
right? Oh,
hungry all the time.
I'm hungry all the time. These could be
Mhm.
little indicators that it might be diabetes. So,
Might be.
okay, I find it's might, not sure, because I could just be hungry because me, I want to eat. Right. So some people could just be hungry. Okay, so I think this might be because I'm so concerned about my health. I want to be sure because of course you want to know your risk so you could know your response, right? So I said, okay, I don't want to go to the doctors yet. So I can buy those little machine, what's it called? The glucometer? That's
Yeah,
it. Yeah,
yeah.
so I can go to the pharmacy and I
Hmm.
buy one of that. And early in the morning, like how they say you do a little pregnancy test, but no, you're not peeing on this one. So you have to prick your finger, right?
Yeah.
This is a little prick, and then you put it out there on the strip, and then you check. And once it's above 100 and how much? Five,
So
7?
first thing in the morning, if it's
First
over
thing.
110,
110.
you need to check your doctor.
Okay, so
Let's just keep it simple. If it's more than 110, check your doctor.
right. Somebody type in
Mhm.
the chat now. Check your doctor. Check your doctor. Check your doctor. Check your doctor. So I have it so far.
Yeah.
Things I prick. I check one morning. Then we don't believe nothing. So morning number two,
Doesn't
I check
believe
again,
you.
and
Yeah.
it is still over 110. So I
Hmm.
go to the doctor. What are the expectations? There's a test you said the doctor normally runs that checks for the
Hmm.
3 to 4 months. What is the name of
Yeah.
that test
That's
again?
the HbA1c,
The
right?
HbA1c. All right.
Mm-hmm.
And so they check and they see that range. So as they're checking that range, once it's above 6.5,
Mm-hmm.
then does that mean I have diabetes, or does it mean I'm prone to diabetes? We want to clear that part up. Talk to us, Doc.
There's
Talk
a
to us.
pretty good chance that you have diabetes.
Pretty
There's a
good.
pretty good chance that that is just what it is. I mean, of course, there are certain mitigating factors in terms of the testing world, but there's a good chance that that is what is going on, especially if you have that you already checked your finger, you were getting a high report, and then the A1C just confirms so
Right.
that you have those two things going together, especially if along with that you have symptoms. Yeah,
Right. So I've
yeah.
been, so the doctor says, well, it looks like you have diabetes. Is that a death sentence, doc? When they say you have
Hmm.
diabetes, what happens there? What do you do now? Do you go home, write a will? I mean, what happens when you find out I have diabetes? Is that the end of my ice cream journey?
Well, okay, all right. Um, no, I have dubbed these things that I want to tell you about the influencers. There are five influencers when we're thinking about diabetes,
All right,
and
take
they're
a note
all
of this, people. These are the five
five
influencers.
influencers.
These are the things that means these are the things that make you get diabetes.
Things that encourage you to get it. Yeah.
Oh, these are diabetes enablers. All
Yeah.
right. Tell us, doc. I want to know. Give way, doc. Go ahead. What are the five
All
influencers?
right. One of them is excess starch.
Hmm.
Starch. Yeah. Excess starch. Right. The other one is excess sugar.
Hmm.
You know, sugar had to be in there somewhere. So that's where ice cream came in. Sorry. All right. Another one is stress.
Hmm.
Too much stress. And this other one is too, the other two are too little of these things. Too little sleep and too much of a sedentary lifestyle. So you didn't have enough exercise. So let's go through those five again. Sugar, starch,
Hmm.
stress,
All right.
lack of sleep, and a sedentary lifestyle.
Okay.
These are your influencers.
All right. I hope we got that, people. Put that in right now. Put that in. Sugar, starch,
Starch.
stretch,
stress.
sleep, and sedentary lifestyle. You know, a little of these. I feel I could go in the medical profession now. Just okay. Right. So these are enablers. When you have too much sugar and starch and those things, they contribute to one having one getting diabetes. So somebody wants to know in the chat. Shirley saying, Doc, can certain medication cause you to develop diabetes? She's waiting for
That,
an honest answer. And you're an honest
that
person.
is, yes. Unfortunately. Think about it this way. Yes, different medication have different side effects, right? There's a group of medication called the type of water pill. It can be like benzoyl-thiazide. So your thiazide diuretics,
Right.
they can actually encourage your sugar to be higher than normal.
Wow.
Your statins, yeah, those are your cholesterol medication. They can encourage the sugar to be higher than normal. Also, steroids, like your prednisolone and these things, they can raise your sugar as well. But the main one that would cover a whole category by itself to say steroid induced diabetes. So there's such a thing as steroid induced diabetes. And of course, this can happen to anyone who has to be on steroids chronically,
All right.
right? So somebody who has some type of autoimmune disease, they have rheumatoid, Crohn, something, and that is why we try not to use too much steroids. And for some persons, they would end up on stronger drugs, what we call disease modifying agents or steroid sparing drugs, to try to keep you away from the steroids. Yeah.
Okay. Wow. Wow. That is important. I am no
Mhm.
doctor, right? I am no doctor.
Yeah.
But in my little observation, I haven't done any research. Maybe I should have. But this question came to mind. I have
Yeah.
observed in my little observation that
Hmm.
many times people who have hypertension develop diabetes, and people who have diabetes also develop hypertension.
Yeah.
Is there some sort of link? I've been wanting to know that answer. Is
That's
there a
an
link?
That is an excellent question because definitely there is. Think about it this way. They are both lifestyle diseases, yeah?
Right.
So if we think that they are both lifestyle diseases, therefore there are certain lifestyle things that would that are across the board that would encourage them both. So if you're sedentary, your sugar will go up, but also your pressure might go up because you're gonna gain weight. If you're using too much starch, too much sugar, you'll probably gain weight. And when you gain weight, your pressure is going to go up. If you're stressed all the time, your pressure is going to go up too. And sleep deprivation is a risk for hypertension. So when you think about it, the same things that influence you to become diabetic also influence you to have high blood pressure. But there's another reason as well, especially in a diabetic person becoming hypertensive. So you remember the issue with diabetes and hypertension, them both, they do affect your blood vessels. Affecting the blood vessels would mean that you can have hardening of the blood vessels, you having damage to the blood vessels, and therefore that can affect your blood pressure. It can affect your kidneys, yeah, and once your kidneys are damaged, which your kidneys are so important in the management of your blood pressure, so let's say you started off with diabetes, you ended up with kidney disease. When your kidneys get damaged, your pressure has no choice but to go up because the kidneys are not able to regulate the blood pressure as it's used to. So that is one of the very important links. Just the reality that the lifestyle things that occur are similar in them both. And anytime you touch the kidneys, the pressure is going to go up. Yeah.
Wow. You see, Doc, I'm telling you, I have noticed it. I have noticed it. Right. What I want to know, all right? Someone sent me a message here. These are big words. I hope I pronounce them correctly. Um,
Yeah.
can you provide guidance on what's this word? Can you provide guidance on hypoglycemia? I guess that's low blood
Mhm.
sugar, and
Yes.
hyperglycemia.
All right.
Hypo and hyper.
All right.
Mhm.
So hypo just means low, hyper means high.
Yeah.
Um, and the symptoms that someone may experience when they're having these situations would vary. So when you are hypoglycemic, the feeling that you may have is like a faint feeling or a very hungry feeling, a very weak. The person may cold sweats or feel like they're gonna pass out. And of course, a very easy way to deal with that is just quickly put something sweet into your mouth. Um, and your sugar is gonna come up. The things that would predispose someone to go hypo is if they took their medication, like let's say they're diabetic, they took their medication and they didn't eat,
Mm.
or they are diabetic and they exerted themselves beyond the normal amount so that the sugar working along with their exercise, their medication working along with their exercise rather cause the sugar to drop too low. Or it can be that can happen in a person whose kidneys are starting to fail or someone who has liver problems. Yeah. And so that what they're eating along with the medication, it is there's an imbalance there. So they're not either not eating enough to sustain the sugar, or the medication, because the kidneys and the liver are not working, the
All right.
medication is actually causing the sugar to drop faster than normal. So the symptoms, once again, a faint feeling, feeling like you're gonna black out, you might be cold sweating, the vision may get dark. These are some of the things that the person may experience. Versus hyperglycemia, the feeling may more be similar to what we described as the symptoms of diabetes itself. So feeling thirsty, feeling hungry. Some persons get a headache or they feel very weak. And the interesting thing is that both states can cause a coma. So you can go into a coma because your sugar is too high or because your sugar is too low. However, the one that is going to cause a coma faster is low sugar, hypoglycemia. So sometimes we'd have a person come into the emergency room and they are flat out unresponsive. And they are the basic things that we do for them very quickly. We try to revive them. But especially if we know they're diabetic, we check their sugar. And lo and behold, when we check their sugar, we get to discover the sugar is too low to be read by the machine. It just says LO. LO means too low. I ain't going down there to read nothing. You need help, right?
Wow.
Low. The machine says low. And all we need to do, we quickly put up an IV on the person and we push 50% dextrose into their veins and they immediately revive.
Wow.
Immediately, right? Now, the converse thing can happen. The machine can tell you HI. If you're diabetic and the machine says HI, depending on the range of your machine, your sugar is probably either over 500 or over 600. And you need emergency attention, or else you can become so dehydrated that you can go into a coma as well.
Wow, doc. That is serious. It
Yes, it
is.
is.
How does it makes me to how do I know if I'm going into a coma? How do I know? I heard the dizziness. Some little blur vision. Hunger can be one. If you know you're
Um,
going in. No.
when your sugar is dropping, you can feel a bit hungry, yeah.
Yeah.
But the thing is that if you know that you're diabetic, or even if you don't know,
Yeah.
because I've had a couple patients recently who didn't know
All
that
right.
they were diabetic, they just and God, listen, God is so good. God will send these people, they complaining about something completely different. Just
Wow.
saying. They have a pain. They're feeling dizzy. Something, they're just not feeling themselves. They can't explain it. And we check their sugar and it's HI. And we're like, we check it again, it's still HI. I'm like, right? That person needs emergency attention. So we have to put up a line, give them drips, give them insulin. And these are things that would a lot of times have to occur in an emergency room because it's really, really a medical emergency. And that person does not get to go home until their sugar becomes readable. That it comes into a range that that it can be read.
Oh,
Yeah.
thanks very much for that information. For those of you who are joining in right now, it is still an opportunity to share the link. You know what I say? Share the link and save a life. All right, you have the opportunity to do so now because we're talking diabetes, and it is important that when we discuss this matter, that we not just keep it for ourselves, but we can help somebody, as we would have learned earlier, that there are 50% of the people who are not aware that they have diabetes. You could just be randomly watching this program now, and God forbid, you could be suffering from diabetes. So here at I Walk Talk with Pastor, we want you to know your risk so that you can know your response. And one of the risk, doc, I must ask you here, are what are some other potential complications with diabetes?
Great question. And you can think of these complications from the head down.
Okay.
So diabetes can cause a stroke.
Hmm.
It can cause blindness. Is one of the most preventable causes of blindness worldwide. So
Hmm.
anyone who has diabetes needs to get their eyes checked on a yearly basis. It can cause a heart attack,
Yes. Oh.
right? It can cause kidney failure. Uh, and this other one, when we go down a little bit more, for this one is for the men, right? It can cause failure of the boy. I don't know, men like to call them the boy, but
The boy.
erectile dysfunction,
Wow.
right? And
Wow.
erectile dysfunction, men, don't be selfish. I guess yourself check because if you have erectile dysfunction, you're gonna have a frustrated wife. Just saying. Everybody gonna be frustrated. And then when we go down lower, there is the issue of diabetic neuropathy, right? Where the nerves in the feet don't work very well. And this can lead to numbness in the feet. You lose feeling, burning in the toes. And this can eventually lead to amputation.
Wow.
This is how people can lose their legs. And of course, diabetes can cause all of you to cease to exist. You can die because of diabetes. And it's not that diabetes is a life sentence standalone, but when
Right.
it is not managed well, it can bring about your demise.
Management. And we must go back to the 5S that you spoke about when it comes to management, which we have to watch the sugar intake, the starch, get enough
Mhm.
sleep, avoid stress. I mean, I'm not sure how we get that one done, but
Manage it.
you can manage your stress. You can
Yeah,
have stress, but don't let stress stress you out.
yeah.
And avoid sedentary lifestyle. So don't just sit down, exercise. This is I talk with Pastor, but I walk with Pastor. We encourage you to get up and go. It's all about movement, folks. So if I am not examining these 5 areas, then there could be major complications. We're talking blindness, stroke, kidney failure, losing limbs. And gentlemen, come closer, listen in. We are also talking about erectile dysfunction, gentlemen. So that is why it's important, when you feel off, that you check it. All right, you went to the bathroom, and there was a little spill, and you came back and you realized ants by the spill. That's some time to start get some checkup. That is the time to check up. It therefore means then, doc, how often should one now um, contact their healthcare provider? So I've been diagnosed with diabetes. What should my relationship be like with the healthcare provider? How
Mhm.
often do I need to come in every week, doc? Doc, check me, check me, check me, check me. I'm feeling something. How often?
Well, honestly, sometimes at the start, like for example, those patients that would have come in with their sugar as HI.
Yeah.
Yeah, I'm gonna need to be seeing you in a few days, right? Because
Right.
the sugar has to come down, take its time and come down from over 600 and eventually 200 and eventually into normal people range, 100, 100 and something. And sometimes that can take a little back and forth. So if someone is diagnosed, newly diagnosed, your doctor may ask you to come again within a week or two just to see how things are going. If you were not in a danger zone, you may have a 1 month appointment. However, the chronic diabetics who are well controlled, it's a good idea to touch base with your doctor every 3 to 4 months. All right, just so that you can see how things are going. You want to be able to check your eye doctor once a year to make sure that things are going fine. And let's say you're perfectly normal, you have no diabetes, it's important to know your numbers. Because if you're checking your numbers, you might be able to pick up, right? You will actually be able to pick up. You should be able to determine when things started going awry, right? You would have noticed, my fasting sugar was always 100, 100, 100, and it reached 105. Then you start to see 108, 109. You're not going to wait for it to be 110 to check your doctor. You're going to go back to your influencers and make sure that those things are in a gear, right? You're going to make sure of that. So that knowing your numbers is important. And of course, if you're diabetic, you need to take your medication. All right, that's really, 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 really imperative. Some persons they want to incorporate some natural therapies, and that's all right. All right. So you have your moringa, your cinnamon, your karaili, and these are good things. All right, they are very helpful. However, if you are already on medication, you may want to just have that little discussion with your doctor. Be very cautious in how you're combining the medication along with the natural things, because the combination can cause your sugar to go too low, and that can cause a little issue.
All
Yeah.
right. So you're saying that there are some people who also employ the use of natural medicine in order to manage their diabetes.
Mhm.
Someone would want you to know, what about pregnancy? How do you manage diabetes during pregnancy?
Right. So diabetes in pregnancy is typically managed by the obstetrician.
Okay.
So there are two different types. So you have gestational diabetes where the diabetes is brought on by the pregnancy, and that has to more do with like a glucose intolerance. The body is not able to tolerate sugar very well. These patients are usually placed on a very strict diet. Many times they have to take insulin because not all the types of medication typically available to diabetics are safe in pregnancy. So a lot of times you find that diabetic mother may have to be on insulin and a very strict diet. However, there are other persons who were diabetic before and then became pregnant, or they were already borderline, so that the stress of the pregnancy, the weight gain, how persons kind of do their diet differently when they're pregnant. And these things can actually lead to them triggering the full out diabetes. So it's really managed by the obstetrician, but it has a lot to do, once again, with lifestyle changes, managing that diet.
All right. So we have a question in the chat. This question is coming from Kizzy. She wants to know, I hope I pronounce this word right. Is berberine, I don't know if that's the same as babadine, a good alternative medication? This supplement is becoming popular. Do you know about it? Is that a good alternative?
It's
Pronounce
like
the
a
word.
vitamin, it's a type of vitamin B1, and it can be helpful for persons who have diabetic neuropathy, where their nerves are starting to give them some problems, and that can be
Right.
quite helpful. And there are different types of formulations on the market. Some things would be framed like a supplement, and other things may be framed like a medication. It really depends on who produces it. But a lot of times there are some natural things that are framed like a medication. So, for example, you have like your neurobind is really vitamins, vitamin B1, B6, and B12. And that combination can be really helpful for those with diabetic neuropathy. Right? You're having burning and tingling in the feet. Of course, you need to control the diabetes. But taking a vitamin B supplement can really, really help the nerves out a lot.
Okay, wow, thank you very much. Taking a vibe. No, we can be here and ask you questions whole night, but we will consider about two more questions. Um, this is not part of it, but I want to know, what about when you have children? How do I avoid my child or my children from getting diabetes? How can I do that?
Right. So now the main thing to know is that type 1 diabetes is not preventable. However, that being said, childhood obesity is a new thing, you know. Back in the days, there was very little of that because we all went outside and played cricket and scotch. And we were so active when we were younger. So that in terms of your children now, because the new play is with devices, now you have to encourage your children to go outside and play the same things we spoke about, right? But for the children, it will be focused in on diet and activity, right? Diet and activity. So it's okay to determine what your child's diet is going to be like. When they get grown, they can do whatever they want, you know, but honestly, persons tend to eat the way they were trained to eat or what was very customary in their household. So you actually, as a mother, as a parent, as a guardian, you actually have the opportunity to influence your child away from diabetes by the way you practice their lifestyle, by the what you give them to eat. You know, you can teach them about portion sizes, about what is enough. Like, you know, this is enough.
All
You don't need
right.
more. You know, you had macaroni pie. You know, so even like when we prepare the meals, we shouldn't have too much starch available. So we have rice and macaroni pie and potato salad and provision and some other thing that is starchy.
Okay,
You
that's
know,
all the time we have for the program. Go ahead. That is very important. I was just kidding there. That is very important. I want you to re-emphasize that because it is also a personal area that I struggle with, especially on Sabbaths, you know. Um, you have the rice and the you said provision, and we have the macaroni pie and the corn pie, and you know the gluten pie, and we have all of these different pies
right.
inside, and we have, you know, channel. And is it that we are not helping ourselves?
Yeah. Sometimes we tempt ourselves unnecessarily, to be
Okay.
honest. Yeah. So it's like understanding what the fruit groups are like and understanding that flour is particularly bad for diabetics.
Wow.
Flour would raise your sugar. So knowing that in your pasta there is flour, for some persons, white rice raises their sugar as well. So there are little things that you can do, like switching out your white rice to brown rice. You can use quinoa, you can use gluten-free pasta, and that can be really helpful in terms of keeping these sugars down. But trying to restrict, like when you're preparing the meals, try not to provide more than two starches, you know. But if you do provide a lot of stuff, then that means the person has to have very, very little portions of each one so that you don't consume more than your hands worth, right? Not more than your hands worth of starch,
All right.
right? Yeah.
All right. Well, we have learned a lot today, Doc. You know, I know folks may still have their questions. You can always contact Dr. Tobias Joseph, and you know, you can go in and see her if you're in Tobago, or she also does Zoom calls, hopefully, and where you can contact her and talk with her. It is a it was a pleasure having you here on I Talk with Pastor. Is there anything else you want to share with us and leave with us before you go on this whole matter of our health? And we're talking about diabetes awareness.
Well, the main thing is that you cannot fix what you do not know.
You cannot fix.
Therefore, you cannot fix what you do not know. Therefore, you can make it your habit, even if it's once a year on your birthday. I don't know. Find a way to integrate it that you would check your numbers. Of course, it's great to do it more than once a year. I would suggest that it's a wise thing that persons could have these devices at their home. We have all kind of devices that cost much more now.
Yeah.
You know, the cost of a blood pressure machine or a glucometer, is minuscule in terms of the cost of a phone. There's no decent phone that you would get for those costs. So it's a good idea. If you have those things at home, you don't have to go by the health center to line up to get it checked. Just know your numbers
Know your
because you cannot,
numbers.
yeah, you
Somebody,
can't fix what you don't know.
all
And
right.
as you
Somebody
said
need to
there,
put
know
that down
your
on
risk,
your number.
know your
Yes.
response. Yeah.
Yeah. Know your numbers. I want you to put that in the chat right now. Know your numbers. So you're advising. Maybe you don't know, maybe you don't have some of these symptoms or so on, but you need to know your numbers. Check if it is once every year. You know, whether it's on your birthday or after the day after your birthday, the day before your birthday. Have a specific time of the year that you know you want to check. I know sometimes people are afraid to check. It's like, oh, we don't want to be looking for anything. But you can check. All right. We have a question. I don't want to leave it out this question. Is intermittent fasting advisable for diabetics?
It's a good question, Kizzy. Thank you. So intermittent fasting is good. However, if you have a diabetic who is on medication, they need to discuss this with their doctor. And one of the things that a person can do is just sometimes the way that we might think about it can be a little different. So you can fast overnight by having having your last meal much earlier, you know? So for example, let's say if you had breakfast at 6, if it was, if you wake up that early in the morning, let's say if you use a little later time, 7, and you had your lunch at 12, and then you had your dinner at 5, do you realize that if you eat nothing else, right, after 5, if you eat nothing else, you would have fasted from 5 o'clock in the evening until 7 the next morning? That was 14 hours. So it's possible that you can do that. But if there is a diabetic who is on medication, what I would suggest is that you may want to speak to your doctor, let your doctor know this is what I want to do, and your doctor would guide you accordingly or adjust your medication to make sure that you do not have any hypoglycemic episodes that can cause you
Yeah.
to go into a coma.
Yes. Excellent, excellent. We're all out of time here. This is such an important. We could talk about this whole night because our health is important. And if we manage, a major thing I hear, even as we discussed cancer last week, it's about managing our stress. It's about getting rest. I mean, I know many of us are on the grind. We want to get the money because we want to achieve certain things. We want to get this, and we are doing all of that to bury ourselves. We're basically earning monies for our funerals. That is what is happening because we're not taking care of our bodies as we should. And so I want to encourage you, friends out there, that you need to take care of this one body that God has blessed you in. It is a temple of God, so we've got to watch what we're putting into it. We've got to watch what we're allowing to come into our minds and is running around in our thoughts. We've got to get that rest. Sleep. All right. What's your sugar level? Check your plate. Know what you are eating because it is so important. All right. So I know we've come to an end, but you can still, if you found this very important, I want you to share it and I want you to help me thank Dr. Tobias Joseph for being here. So say thank you, Doc. Thank you for being here. Now, friends, as we continue for the month of November, we will be touching some very important topics. And next week, I don't want you to miss next week because next week we're going to be talking about romance and finance. Romance and finance. All right? You don't want to miss it. It's going to be ah, an interesting discussion. That I can guarantee you. An interesting discussion. All right. Thank you for being here. Share the link and save a life. Remember, when we think of diabetes, we ought to you ought to know your risk so you can know your response. God bless you and God keep you. as we continue to have this conversation about life and faith. This is Pastor Nicole English signing off for I Talk with Pastor. Bye bye.